This recorded lecture will be going over Chapter 16, Infection Prevention and Control, Protective Mechanisms and Asepsis in the Fundamentals textbook. An infection is the entry of an infectious agent, a microorganism, into the body that multiplies and disrupts tissue integrity. Healthcare professionals work to eliminate infection from the body and to prevent its spread to others. Careful hand hygiene is essential to prevent cross-contamination. Non-pathogenic organisms that are prevalent on and in the body are called normal flora. Normal flora prevent more harmful microorganisms from colonizing and multiplying within the body. Normal flora accomplishes this by occupying receptor sites on cells, monopolizing nutrients, and secreting substances that are toxic to other microorganisms. Some pathogenic microorganisms produce harmful toxins, and others will release endotoxins. Endotoxins are responsible for symptoms seen in diseases like botulism, tetanus, diphtheria, and E. coli infection. This is a list of some potential infectious agents that we will be going into some more in-depth information about over the next few slides. Bacteria are single-cell microorganisms lacking a nucleus that reproduce from every few minutes up to several weeks. Bacteria are classified according to their need for oxygen, their shape, and their Gram-staining properties. Aerobic bacteria need oxygen to grow and thrive. Anaerobic bacteria grow only when oxygen is not present. A laboratory technique called Gram staining is performed to help classify the bacteria's outer cell surface. The specimen will be tested for bacteria. To be tested for bacteria is placed on a slide, stained, and then treated with a contrasting dye. Those retaining the stain are known as gram-positive, and those losing the stain and taking up the counter stain are called gram-negative. Many gram-negative bacteria are more dangerous than gram-positive bacteria because they may produce an endotoxin that can cause hemorrhagic shock and severe diarrhea, and can alter resistance to other bacterial infections. Classification of bacteria according to their morphology will place them in one of three main groups: cocci, bacilli, and spirochetes. Final identification involves chemical testing of the bacteria by performing a culture. To do this, the body secretion or specimen is transferred to a medium in which it can grow. Sensitivity tests are then performed to determine which antibiotic is the most effective against the bacteria. The four most common multi-drug resistant organisms are methicillin-resistant Staphylococcus aureus, vancomycin-resistant Enterococcus, extended-spectrum beta-lactamase, producing pneumonia, and Clostridium difficile. Patients must be educated about the correct use and possible misuse of antimicrobial agents. You should encourage each patient to take the entire antimicrobial prescription as ordered by their healthcare provider to ensure the full treatment of the infection. Incomplete treatment will allow some microorganisms to live, giving them a chance to mutate and develop drug resistance. Prions are protective protein particles that lack nucleic acids and are not inactivated by usual methods for destroying bacteria or viruses. They do not trigger an immune response, but cause degenerative neurologic disease, such as variant Creutzfeldt-Jakob disease. This is a human version of mad cow. Protozoa are one-celled microscopic organisms belonging to the animal kingdom and can be parasitic in nature. Some protozoa cause malaria, while others cause amoebic dysentery. Other strains are capable of just causing diarrhea. Viruses are extremely small and can be seen only with an electron microscope. They can grow and replicate only within a living or host cell. Herpes, Ebola, and COVID-19 are all examples of viral infections. There is no cure for viruses, but certain vaccinations can prevent the spread of disease. Rickettsia are small, round, or rod-shaped microorganisms that are transmitted by the bites of lice, ticks, and fleas, as well as mites, that all act as vectors. Examples of rickettsial infection include Rocky Mountain spotted fever and typhus. Fungi are tiny, primitive organisms of the kingdom Fungi that contain no chlorophyll. Examples include yeasts and molds. They thrive in warm, moist environments. Fungi reproduce by the means of spores. In humans, fungal infections are also known as mycoses. Helminths are parasitic worms or flukes belonging to the animal kingdom. Pinworms are most commonly affect children, but they are the most common helminths worldwide. Roundworms and tapeworms are other helminths. The process by which an infection is spread from one person to another can be thought of as a continuous chain. Nursing care will focus on breaking that chain of infection. On page 224 within figure 16.3, you can see an example of the infection chain, a diagram. A causative agent is any microorganism or biologic agent capable of causing disease. These agents include bacteria, viruses, protozoa, prions, rickettsia, fungi, and helminths. Some microorganisms are more virulent than others. Characteristics that affect virulence are the ability to adhere to mucosal surfaces or cell walls, penetrate mucous membranes, multiply in the body, secrete harmful enzymes or toxins, resist phagocytosis, bind with iron. The 4 stages of the infection process are incubation, prodrome, illness, and convalescence. These will be discussed in more detail in Chapter 17. Infectious microorganisms must be destroyed or rendered harmless to break the chain of infection. Procedures for disinfection and/or sterilization should be used in all areas where patients are receiving treatment. Reservoirs are places where microorganisms are found. Reservoirs can be infected wounds, human or animal waste, animals and insects, contaminated food and water, or a person with an infection. Standard precautions are used to prevent the spread of infection from the reservoir. Good hand hygiene is one of the most effective ways to prevent the spread of microorganisms. Using sterile technique, when appropriate, is another effective method. The portal of exit is the route by which a pathogen leaves the body of its host. An example of a portal of exit is the GI tract. The respiratory tract is another portal of exit when microorganisms are released with coughing or sneezing. The skin and mucous membranes can also serve as a portal of exit when an open or draining wound exists. Isolation techniques and barrier precautions that include the proper handling and disposal of secretions, urine, feces, and exudate can prevent pathogen transfer. Modes of transfer of pathogens include direct personal contact with body excretions or drainage, such as from an infected wound, indirect contact with contaminated inanimate objects, such as needles, drinking and eating utensils, dressings, clothing, and hospital equipment, vectors, such as fleas, ticks, mosquitoes, and other insects that harbor infectious agents and transmit infection to humans through bites and stings, droplet infection or contamination by the aerosol route through sneezing and coughing, and the spread of infection from one part of the body to another. The mode of transmission can be interrupted by effective hand hygiene, proper disinfection and sterilization of medical equipment, the use of both surgical and medical aseptic technique in performing procedures and diagnostic tests, and the use of standard precautions to prevent contamination. Pathogens can enter the body through the mucous membranes of the eyes, nose, mouth, trachea, or skin. Using only sterile and clean items when caring for patients will reduce the entry of pathogens. Barrier precautions, safe handling of food and water, good personal hygiene, avoidance of high-risk behaviors, and protection from insect bites and stings can prevent entry of microorganisms. A human host may be susceptible by virtue of age, state of health, or broken skin. Proper nutrition and a healthy lifestyle will increase resistance to infection. Many factors will place the older adult at a higher risk of infection. Poor nutrition, inadequate hygiene, impaired mobility, chronic illness, and physiologic changes will all increase the risk of disease. Older adults also tend to have comorbidities. All of these factors will place them at a higher risk for a healthcare associated infection. This is an infection acquired by a patient after admission to a healthcare facility due to the transfer of microorganisms to the patient by contaminated hands or objects or infected people. Intact skin serves as a first line of defense against harmful environmental agents. Sebaceous glands excrete sweat, lactic acid, and fatty acids to limit microbial growth. Secretions from mucous membranes lining the respiratory, GI, and reproductive tracts all contain an abundance of the enzyme lysozyme. This is bactericidal. Cilia, which line the respiratory tract, trap microorganism and debris, and they propel them up and out of the body with a wave-like action. The intestinal system is a major portal of entry for pathogens, and the liver is an essential part of our body's defense system. The liver also detoxifies harmful chemicals by isolating various substances and facilitating their breakdown and excretion from the body. The body's second line of defense helps destroy pathogens that escape the first line of defense. This includes the mechanisms of fever, leukocytosis, phagocytosis, inflammation, and the action of interferon, which interferes in the replication of many viruses. The increased production or release of leukocytes is called leukocytosis. When an infection and leukocytosis occur, the white blood cell count will be elevated. Phagocytosis is part of the inflammatory response. This is another defense mechanism of the body. Phagocytes work to destroy or stop an invasion. They do this by engulfing and destroying bacteria and viruses. Some phagocytes are called tissue macrophages. Others, which are concerned with immunity, are called the lymphocytic cells. Interferons are produced in response to viral invasions of the cell. The inflammatory response can be induced by any mechanical, chemical, or infectious disease-producing factor that injures cells of the body. Inflammation is an immediate response of the body to any kind of injury to its cells and tissues. Inflammation is a localized protective response brought on by injury or destruction of tissues. The basic purposes of the inflammatory response are to neutralize and destroy harmful agents, to limit the spread to other tissues in the body, and prepare the damaged tissues for repair. During inflammation, the chemicals histamine and serotonin are released. The immune response is the third line of defense against pathogenic organisms. Microorganisms and other substances that do not belong in the body, like pollen, are recognized as foreign invaders and will trigger an immune response. The immune system response is specific to the type of invader. Unique antigens on the surface of individual cells will aid the immune system in distinguishing self from non-self so it can destroy foreign matter or material, also known as antigens. Once exposed to a microorganism, the body will produce antibodies against that invader. In this way, we have naturally acquired immunity. Every antigen stimulates the formation of a specific type of antibody. Some types of naturally acquired immunity, like with varicella, last a lifetime, but others, like with influenza, will last only a short time. Passive acquired immunity occurs when a person is given an antitoxin or antiserum that contains antibodies or antitoxins that have been developed in another person. Tetanus antitoxin is an example of a substance that provides passive immunity. Naturally acquired passive immunity occurs when the fetus receives antibodies from the mother through placental blood before birth. This type of immunity can also be acquired by breastfeeding the infant. It is temporary and typically only lasts until the infant's own immune system matures enough to function properly. Artificially acquired immunity is achieved through the injection of vaccines or immunizing substances that contain dead or inactive microorganisms or their toxins. The vaccine will prompt the body to produce antibodies. Vaccinations against polio, measles, hepatitis B, influenza, tetanus, and diphtheria will all provide this type of immunity. Artificially acquired passive immunity is provided by injection with antibodies derived from the infected blood of people or animals. Serum immune globulin is often used for this purpose and is given to people who have been exposed to hepatitis A virus or mumps and who have not been previously immunized. Asepsis is the practice of making the environment and objects free of microorganisms. Two types of asepsis are practiced within healthcare agencies. The first is medical asepsis. This is the practice of reducing the number of organisms present or reducing the risk of transmission of organisms. It involves cleanliness and is accomplished by protecting items in the environment from contamination and by disinfecting items that have been contaminated. This is referred to as clean technique because most, but not all, microorganisms are destroyed. Surgical asepsis is the practice of preparing and handling materials in a way that prevents the patient's exposure to living microorganisms. Surgical asepsis is referred to as sterile technique. It involves sterilization of all instruments and inanimate equipment, as well as the use of sterile supplies and sterile technique for procedures that invade the body and for wound care. In this, all microorganisms are destroyed. Hand hygiene is one of the most effective ways to reduce the number of microorganisms on the hands, thereby preventing transfer of microorganisms from one object to another or from person to person by the nurse. Gloves should be used to prevent contact with any blood or body fluids. Healthcare workers must perform hand hygiene before and after giving care to a patient. Many hospitals and healthcare agencies will provide alcohol-based hand rubs for personnel to use when hands are not visibly contaminated. When hands are visibly soiled, the CDC recommends wetting the hands, adding soap, performing at least 15 seconds of vigorous rubbing to aid in spreading the soap over the hands, fingers, wrists, and thumbs, then rinsing the hands under warm running water and drying them thoroughly. Do not wear jewelry when you are providing patient care because microorganisms can become lodged in the settings of stones, in the grooves of rings, and on the skin beneath the jewelry. Fingernails should be kept clean and short, both for patient safety and for easier cleaning. Nail polish, if allowed, should not be chipped because it can harbor bacteria. No artificial nails, extenders, silk nail wraps or tips, gels, or nail jewelry should be worn. Proper hand care includes the prevention of hangnails and skin abrasions, which can be portals of entry for bacteria. The CDC has developed standard precautions to facilitate breaking the chain of infection. These precautions protect both the nurse and the patient and are to be used for every patient contact, regardless of the suspected or confirmed presence of an infectious agent. Standard precautions include the use of hand hygiene and personal protective equipment, or PPE, respiratory hygiene and cough etiquette, and prevention of needle sticks and other sharps-related injuries. PPE includes gloves, gowns, masks, protective eyewear, shoe coverings, and hair coverings. Wear a clean barrier gown that is impermeable to water and other fluids whenever there is a chance of being splashed with blood, body fluid, or other potentially infectious materials, or when these fluids may be aerosolized. Apply a regular surgical face mask before entering the room if there is a chance that you will be in contact with an airborne pathogen larger than 5 microns or splashed by body fluids, such as when a patient is coughing or you're performing suctioning. Wear an N95 respirator mask when entering an area where airborne microorganisms less than 5 microns in size are known to be present. N95 respirator masks prevent the passage of 95% of particulate matter. When removing masks, handle only the elastic band or ties and then discard them in a regular waste receptacle. Do not leave them hanging around the neck or in a pocket. Always change the mask at any time if it becomes moist. Wear protective eyewear to prevent fluid from entering the eye area and coming in contact with the mucosa or surface of the eye through splattering or aerosolization. Eyewear may be in the form of goggles, a face shield, or glasses with side and top pieces. Wear eyewear for performing oral, nasotracheal, or endotracheal suctioning, for performing wound irrigations, and for performing or assisting with procedures in which blood or other body fluids might splatter. Place a head cap or cover on the head if there is a danger of contamination of the hair, or if microorganisms residing in the hair might endanger the patient. A head cover is also required in select locations, such as the operating room, because skin can shed into the operative site. This applies even to those who are bald-headed. Shoes are covered so that pathogens are not carried out of the room. The covers should be removed when exiting the room in the same manner as the head cover. Staff are encouraged to wear them in places like the delivery room or in the emergency department when dealing with trauma patients. Wear disposable gloves for standard precautions when there is a chance of contact with blood or body fluids, mucous membranes, non-intact skin, or secretions or excretions. Also use gloves for handling items contaminated with any of these substances. Gloves will reduce the possibility of transmission of microorganisms between the nurse and the patient. Always perform hand hygiene before gloving and then immediately after removing the gloves, because no glove is 100% protective. Gloves are contaminated once they are used and then must be discarded before doing the next task or caring for the next patient. Never reuse or wash your gloves. Exposure to latex can cause redness, local inflammation, and pruritus of the hands, as well as potentially anaphylaxis. People who have had multiple surgical procedures, who are allergic to bananas, kiwis, or avocados, or who have a history of reactions to other latex-containing products are at a risk for developing a latex allergy. Disposable sharp instruments, referred to as sharps, should be placed directly into a special puncture-resistant sharps biohazard container immediately after use. Place all needles, IV cannulas, and any items that are sharp or could cause a skin break in the sharps container. Replace the sharps containers when they are 3/4 full. Dispose of items contaminated with infectious material in sealed, impermeable plastic bags marked hazardous waste or biohazard. These include soil dressings, used sanitary pads, suction drainage containers, and any other item that has been in contact with bodily fluids. Gather the soiled linens carefully and bag them at the site of use. Pathogens can be killed or inactivated by disinfection, sterilization, or the use of sanitizing agents. Water, sewage treatment, and rodent control will eliminate reservoirs for pathogens. Always wear gloves when cleaning visibly soiled objects or performing wound care. You can follow the steps listed on page 240 to clean objects. Disinfectants are solutions containing chemical compounds like phenol, alcohol, or chlorine that kill or inactivate nearly all microorganisms. These chemicals can be caustic to the skin and should be used only on inanimate objects. An antiseptic is a chemical compound that is used An antiseptic is a chemical compound that is used on skin or tissue to inhibit the growth of or to eliminate microorganisms. Disinfectants and antiseptics have bactericidal and bacteriostatic properties. A bactericidal solution destroys bacteria, where a bacteriostatic solution prevents the growth and reproduction of some bacteria. Povidone iodine is an example of an antiseptic. Items that cannot be sterilized, like the skin, can be disinfected with antiseptic agents. Wounds should be cleansed using sterile normal saline or an antiseptic solution. Sterilization is the best method of eliminating microorganisms from equipment and supplies. The most commonly used methods of sterilization involve either heat or chemicals. Moist heat is often used by applying steam under pressure and a device called an autoclave. For cleansing items in the home, boiling in water is the easiest method. Items should be boiled for a minimum of 15 minutes. Items that cannot be boiled or disinfected by running them through the dishwasher sanitize cycle could also be exposed to direct sunlight for several hours. The heat and UV rays will kill many exposed microorganisms. Ultraviolet light can be used for disinfection. The number and degree of home precautions are based on whether there is an infected or immunocompromised person in the residence and what microorganism is involved. Secure contaminated dressings and other disposable supplies in plastic zip closure bags before disposal. A 1 to 10 solution of chlorine bleach and water can be used to disinfect counters and bathrooms if they become soiled with body secretions. Frequent damp dusting and vacuuming will decrease the number of microorganisms within the environment. In most healthcare agencies, an infection prevention and control practitioner, known as an infection preventionist, is responsible for ensuring that infection prevention and control measures are followed. The IP also assesses the facility for the spread of infection. All hospital patients are at risk for a healthcare-acquired infection, and each nurse must be vigilant in watching for signs of infection in every patient under their care. Patients at a high risk for developing an infection are those who are weakened by injury or severe illness, those who have another chronic illness, have a central venous catheter, IV cannula, indwelling drainage tube, or endotracheal tube for mechanical ventilation, the very young and the very old, those who have an open wound, have a surgical incision, or who have a compromised immune system from chemotherapy or immunosuppression.